PAH.TV at CHEST 2015 in Montreal. Thomas Baldrick joining us now to talk about mental health of PAH patients is Dr. Raymond Foley. He is Associate Professor of Medicine and the Director of the Center for Pulmonary Vascular Disease at UCONN Health. Thank you, sir, for stopping by.
Oh, thank you. Thank you for having me.
So, here at this conference earlier, you discussed the topic of mental health for these patients. Give us an overview of what you discussed.
Well, for our conference yesterday, one of the major themes was that mental health issues in patients with pulmonary arterial hypertension is underappreciated. Anxiety and depression are quite prevalent in this disease.
It would have to rock someone's world to get that diagnosis and face what the potential future might be for them.
Oh, no doubt, no doubt. So when you're hit with a diagnosis of a chronic disease that may be deadly, that is progressive, there's no question that it, like you said, it would rock your world and lead to a fair amount of depression, anxiety, and really could take a toll on patients and their caregivers.
So is the first step for practicing physicians to not take it lightly, to not overlook it?
Yeah, so what we found when I reviewed this topic yesterday at our conference was that we tend to, as PAH docs, we tend to focus certainly on the diagnosis, the workup, the evaluation of these patients, and then the treatment and getting patients plugged in. And clearly that's important, that's number one. But certainly I think as practitioners we may underappreciate the impact and the role that depression and anxiety may have in this disease process, and that we need to look for it. Because I think if we look for it, screen for it, that we can diagnose patients with mental health issues and get them appropriate therapy.
What are the effective treatments for patients experiencing this difficulty?
Well, the first thing is to identify the diagnosis, to get that started. So once you've identified that, then getting patients to the appropriate practitioner, so the mental health practitioner, psychiatrist. We have certainly lots of pharmacologic therapies that are available for patients, such as the selective serotonin reuptake inhibitors. There's other medications as well, and certainly there's a role for cognitive behavioral therapy and counseling. But then there's also some intriguing issues that are out there that I discussed during our conference, and that is the role of perhaps exercise in pulmonary rehabilitation for patients. Not necessarily to treat depression or anxiety alone, but as a treatment adjunct. And then perhaps also the role of support groups, so pulmonary hypertension support groups, attending meetings, being involved online with discussion boards, social media. So those would be potentially useful treatment therapies or treatment adjuncts for patients with PAH.
Speaking of the word support, it's not just the PAH patient that is going through this. What about the loved ones? What about the families? How are they impacted by this?
So the families are definitely. So families, loved ones, friends, they're definitely in this ride together, if you will. And so they are certainly impacted because they're often with the patient, they're at the doctor's appointments, assisting them with their treatments, and then it affects them. In fact, studies have shown that caregivers, not only perhaps their health, but also their mental health, are affected as well. So caregivers are also definitely impacted with for loved ones with pulmonary vascular disease.
Very good. Dr. Foley, thank you for your time.
Oh, thank you very much for having me.
Thanks for reminding everybody it's not just the diagnosis, it's the person inside.
Okay, thank you.
Thank you, sir.